back to my channel, everyone. Hope you're all doing well. Hope you're having a great day wherever you are. It's currently January here. We are still stuck in a national lockdown at the moment, having moved out of tier 4 after about a week in it for Christmas. And just getting on with whatever I'm trying to do. I've been putting out quite a few videos, and I know you guys have got MMIs coming up, but I hope you're all doing well. And very quickly before we start, thank you so much for all the support I've been getting in the recent videos. It's been great, brilliant stuff in terms of subscribing. So if you aren't already subscribed, I'd be so grateful if you guys could smash that subscribe button down below. It's really helpful, and it just means that my videos get to come out a lot more often. So yeah, really grateful for that. And today anyway, we're going to be talking about MMIs again. We are going through a topic that will definitely come up, I think, in most MMIs, and it's COVID-19. Now obviously, as you guys know, COVID-19 is one of the most anticipated and probably the most common station to come up in the MMI this year, because it's been the biggest medical topic of the last year for obvious reasons. And as a result of that, they'll expect you guys as prospective medics to know a heck of a lot about COVID-19. And so this video is pretty much out here to not give you information about it, because that's, pretty much on Google. You can go and do research on it, but to give you an idea of what you should be learning for COVID-19 regarding the MMI interviews. The online ones hopefully will be useful to you guys, and let's get straight back into it. So tip number 1 is learn the pathophysiology of COVID-19. Now if you don't know what that is, it's basically what COVID-19 is. It's a coronavirus, and basically the structure of it, and the virus structure, the glycoproteins on it, and what it looks like, what it's made up of, what type of microorganism it is, and all the sciencey biology things about the virus. Because you never know, if you come up to Oxbridge, they could start asking you about the pathophysiology of COVID-19. And it's a really cool thing to learn about. And for me, I love viruses, I love infectious diseases, it's my little passion. Head over to some sort of World Health Organization website where they've got loads of posters about COVID-19. Head over to Wikipedia, go and have a look at that, or just look anywhere, try and scour some relevant articles and papers about COVID-19 and have a look at the structure of it, because it's very interesting to find out why COVID-19 is so transmissible and so dangerous. Second thing I would recommend learning about is the lockdown. There have been plenty of lockdowns. First thing to note is to make sure you understand how many lockdowns there have been. I believe we're on our 3rd national lockdown. Please do understand what a lockdown is, how many we've had over the last year, and what they are, what they aim to do. So it's really important, because they could ask you, why did we have lockdowns? Why have lockdowns been implemented? And you need to understand how they affect the transmission of diseases like COVID-19. Number 2, the government. So firstly, they'll probably ask you, well, it's a question that could come up every year. Who's the health minister? Matt Hancock is the health minister. He's probably known by everyone in the country now. You should also know a lot about Professor Van Tam, who's obviously one of the senior advisors to the Prime Minister, and SAGE, so what SAGE is, who they are, what they do. So pretty much the whole health structure within the government should be something that you guys know about. As well as this, you might decide to have your own opinions about the government. So they might ask you, what do you think the government did correctly? What do you think the government could have done differently about their approach to the virus? And this is a really good question that you should form opinions about. Now, you could think a lot about how they put lockdowns into effect, how quickly they put these lockdowns in, and what they decide to keep open, what they prioritised above public health. The Eat Out to Help Out scheme, obviously a controversial scheme. As well as this, you can talk about keeping things like, for example, theatres open, shops open, what they should have kept open during the pandemic, and things like that. It's very important to understand that you can't go on a rant about the government in your interview, but you should be able to form a respectful opinion about it. The third thing I would say is the seasons. Now, it's a really odd thing to think about, but it is quite a big part of the pandemic. Seasonal transmission. They might ask you why COVID-19 wasn't so badly bigged up in summer as opposed to winter, where cases rose, deaths rose, hospital admissions rose, and it was a huge problem in winter. Now, you have to do research around this. This is an area where it's easy to give away generalizing statements, such as, during the winter it's easy to catch a cold. Is that true? Is that necessarily true? Everything you need to say has to be scientific and backed up by some sort of factual basis or evidence-based papers that you've read online. So when they ask about seasonal transmission, don't just think about the biology of a virus, why it might be more adapted to surviving in cold weather. Think about public health. COVID-19 is a pandemic. It's so important to think about epidemiology and public health. Think about in the summer months and the winter months. Why might COVID-19, why might any virus transmit more easily during winter? So think about that, based on both its virus and its biological properties, and based on also people's social behaviours during winter. Number 4, intervention. So there have been a lot of interventions during the COVID-19 pandemic in an attempt to reduce transmission, and namely some of these have been stopping all elite sports for the entirety of the year, implementing face masks as a measure, which was obviously at the beginning not really recommended by the government, but some reason only later on they decided to implement it as a measure. So they might ask you to talk about a particular intervention. For example, they might ask you to talk about hand gel. Why is it being implemented in the COVID-19 pandemic? What is hand gel? Why is it so important? Why does it kill viruses? What's in hand gel? You need to talk about its alcohol hand gel only. It must contain 70% alcohol at least. Why does it have to contain at least 70% alcohol? Well, at that level it's toxic to the virus and kills it upon contact. They might also ask you about some of the interventions regarding hand gel and why they're not so good. So for example, they might say, why is washing your hands better than using hand gel? And they might start asking you about why might it be a bad idea to carry hand gel everywhere? What are some of the negative connotations of having hand gel stations in supermarkets? They can be a hotspot for transmission, obviously. If you don't properly clean your hands, you can just leave the virus around the hand gel station. So things like that you need to be picking up on. Think negatively and positively about intervention. Hand gel, face masks, and anything else you can think of the government implemented. The 5th thing I would say is Christmas. Christmas was a very different occasion this year for most of the country, and if you guys are going to do interviews in Imperial College, King's College, anywhere in the London area, anywhere which is in Tier 4, they may well ask you about Christmas, and they might talk about, do you agree what was done in Christmas? Now, there's nothing wrong in saying no here. You just need to tread the fine line of not actively attacking the government or abusing them. You just need to say, well, I think it was a good idea, but I think there could have been more done to prevent the transmission during Christmas. For example, putting other areas in Tier 4. You need to think about, well, how much of an effect would it have had on transmission, but also you need to understand that while it is great to have interventions and lockdowns, human mental health is also very important, because while the COVID pandemic may be reduced by lockdowns, there would be another pandemic of mental health problems rising. So you need to be able to show that you're aware that you have to balance lockdowns and public health interventions with mental health of the population. So you can't just put everyone into lockdown, because depression rises, and as a result of depression, suicide rates rise, and it's not a really good thing to have in a country. As well as that, it can cause public to get angry at the government, which should never be the case, because if they get angry at the government, they're less likely to listen to restrictions that may be needed later on, and especially times of crisis points. For example, now, where the hospitals are reaching their breaking point. And the final 2 things I would say are again more to do with science, like the pathophysiology we spoke about earlier, and that is to do with the variants. So the variants obviously are very concerning. At the time of recording, there are 2 main variants going around, which was one was found in Kent and one was found in South Africa. And you need to understand what is a variant, why do variants come about, and what is so dangerous about a variant. So obviously you need to think about natural selection for a virus. A virus will pick up on the fact that people are getting more immune to it and will start to change so that it can adapt to getting more people infected. As well as this, you need to think about its effect on our efforts to contain the pandemic, because it means it becomes more transmissible. It evades more of our interventions. And the final thing to do with variants, and also linking into the new topic, is vaccines. This is extremely likely to come up. At least they might talk about what is a vaccine. You need to talk about there being multiple types of vaccines. So you could have a active vaccine, a weakened vaccine, a DNA vaccine, RNA vaccine, a carbohydrate vaccine. Go and do some research online. There are loads of different types of vaccines, and they'll ask you about why do they work, how do they work, and what is the problem with COVID-19 vaccines at the moment. Now, you have to talk about a lot of things, including the variants. So for example, variants have varying efficacy on these vaccines. The cold storage problem. Now, this cold storage freezer whole thing about these vaccines is that they have to be maintained at certain temperatures, and it's very difficult to keep them in the short supply chain, because without that you can't keep your vaccines in storage areas, which means that they can't get access to the population. Most of them will end up becoming ineffective or invalidated because they're being kept at high temperatures than they should really be kept at, and so it causes problems both financially. It's a waste of money making these vaccines, both in the case of medically it's a problem because people can't access the vaccine, and in the case of timely, it's not time effective to have so many vaccines coming in, day out. You need to be able to keep them all in a particular area for a long time. So that was everything I can think about regarding the COVID-19 pandemic and how it might come to MMI. If you guys have got any questions about it, please do drop them in the comments below. I'm more than happy to reply to them, as I've been doing for previous videos. Also, my Instagram will be on the screen somewhere. please go and follow me so you can get up-to-date news about new videos coming out. And also, feel free to ask me anything. Just DM me, slide into my DMs and ask me anything you want. As well as that, I am reminding you guys that the BMAT video should already be out by now. If not, I am accepting any BMAT Section 3 essays you'd like me to mark for free. So please do send them to me via Instagram, just DM them to me, and I'll go over them and mark them for free. Obviously, I know it's very difficult to get access to free marking services, so I'm giving myself up as a free one. Yeah, that's everything. I hope you guys all have a great day, and best of luck for your interviews. I will hopefully put out a few more interview videos. If you've got any other videos you want me to talk about, put them in the comments below, and I will make one and publish it, hopefully. And yeah, best of luck for everyone, guys, and I hope you have a great day. See you in the next video. Peace.